do is you're going to stabilize on the proximal bone, and then what you're going to really do is just rotate the toe outward with Valgus, apply Valgus force to the outside of it, which is basically putting pressure on the medial side of the toe, which is basically kind of, if you do the same thing with the knee with the MCL, test for MCL sprain, kind of just doing that. And then the positive test would be like a pain or increase in laxity in it. And then once you do that, that's pretty much that test. I didn't really know we had to look up the I guess what it was positive, what we called.
Tell me this, which way are you taking the toe?
Oh, you're doing this way.
You taking the toe that way?
That
or
way.
This way?
That way. For Valgus.
Okay. Remember this. If we're going to assess the MCL, okay, which way do we got to take the toe? It's got to come this way. Okay. You have to take, because this is the medial side. We know, and you did a great job saying with the MCL in the knee, you get hit here, we're stressing that a valgus stress places force on the MCL. The same thing happens down the toe. Okay? So you got to take and you got to push that toe. Let me jump in there. The toe has to go out like this. Okay? And you guys, you can move your fingers around however you wish. Okay, but I'll typically just take and go just like this, and I'm putting the force here with my index finger, okay, and I'm stressing this part over here, okay, and if you stress this part, what are we looking for here? Like, what are some possible injuries? We're checking the collateral ligaments, and specifically, anytime you hear valgus, what did Monty tell you that we're going to always assess? We're always assessing the medial collateral ligament. Okay. Now that is going to hold true, not just with the toes. It's going to hold true with every joint in the body. So anytime you hear valgus stress, we're assessing that medial side. And now, Monty, what about the other one?
For varus, you kind of place the same way, except that you're going to go inward with it, which is testing the lateral side of it, when the collateral ligaments, right?
So which way you're taking the toe this time?
This way. This way.
You're taking the toe that way.
That way. This one.
Okay, so the varus stress is going to be just the opposite. Okay, so we got valgus, which is going to be going where you're pushing, you're bringing the toe inward. Okay, because I'm automatically putting a valgus stress on there. What was one injury or pathology that I told you guys about during the observation that we always wanted to look for? No? Yes, and what is the condition that leads to bunions? Hallucis valgus, okay? So hallucis valgus is going to be when you see that big toe in here, all right? Why do you think we call it hallucis valgus? Because there's a valgus stress being placed on it, okay? So you got a valgus stress here, and then with the varus stress, you're going to take and go just like this. So I'm pushing the toe medially, and I'm also taking my thumb right here is pushing laterally. Does that make sense? Everybody understand that? I don't want anybody to be confused on the valgus varus, because those two tests are things that you're going to use on almost every single joint in the body.
So